As a healthcare organization, we take in patients that come with infections. So when we have a patient that discharges, we want to make sure that we have a clean and safe environment for the next patient that will be placed in that patient room. We've had one robot in place for approximately 2 years, and that's priority was to clean our operating suites.
For us in the OR suite, we call the Xenex machine Kenny. Ted, our OR EVS personnel, runs Kenny on a daily basis, and what he does is he waits until we've got the patient out of the room. He goes through and gets the room all cleaned up, which is wiping down surfaces, the bed, mopping the floors, that kind of thing. Once the floors are dry, Ted brings Kenny or Xenex into the room, and he does 10 minutes on one side of the bed, and then he does 10 minutes on the other side of the bed. That way we're getting the entire OR room.
Hospital-acquired infections are something that you always look at because you don't want to cause an infection to your patient when they come to the hospital. So this is a second line of defense. It helps us reach that goal of having no hospital-acquired infections.
The Xenex machine uses ultraviolet light to kill things like bacteria, fungi, bacterial spores.
This addition of the second robot will allow us to clean every single room on our surgical floor after every discharge, regardless of whether or not that patient had an infection.
Kenny is designated to work in the OR or the perioperative setting, and Abby is designated for our medical surgical floors. Having Kenny and Abby sets us apart just because we are able to be proactive on preventing infections.
Every time you come to our organization, you'll get great care, and that's what we are striving for. Not just reducing hospital-acquired infections, but creating a highly reliable and safe organization.